Dear friends, in this video, I'm going to show you a case of hypermature cataract and how you can successfully manage the nucleus in such cases. So it's always preferable to do a staining of the capsule using a trypan blue. This is to avoid undue complications during the rhexis, because the key point for a successful FICO surgery, as we all know, is a successful clear rhexis in such cases. I normally use two side ports around 2 to 2.5 clock hours from the main port. This is for the bimanual aspiration, and I use the side port for the rhexis also. So this is mainly because I feel the stability of the anterior chamber during the rhexis is very important in order to avoid the rhexis extension. So these kind of cases, when you go through the side port, there is no collapse of the anterior chamber and the rhexis is completed in one go without need for the multiple injection of the viscoelastic substance into the anterior chamber. You have to change the direction of your force that is applied for the rhexis depending on the rhexis margin, how it is proceeding. If you feel it is extending, it is always better to change the direction of the rhexis force. Now you can see the rhexis is completed. I am removing the rhexis capsule tag. Hydrodissection is not very much needed in these cases because it's a white cataract, and it's better to avoid too much of hydrodissection because of the fear for the blowout. So now I'm putting it viscoelastic again. I've checked for the mobility of the nucleus with the hydrodissection cannula itself. So I'm not going to dial the nucleus again. Now I use a Centurion FICO machine. It's such a wonderful machine that especially in these kind of complicated cases, the stability is so good that you can go to very low parameters and proceed with the FICO surgery with very minimal energy. I normally clear up the central area with the, where there is a loose cortex, so that the energy can be reduced during the trenching. So then once it is mobilized, you can go for the trench. I don't do a full length trench. I concentrate my trench to the central area. So that is where the cataract is harder. So you don't have to really waste your energy trenching the peripheral area. Once the trench is of adequate depth, break the cataract into two halves. Rotate it again. Make sure the separation is completed and you should see a clear space in between the two halves. Now you can start breaking it into smaller pieces and make sure always that the separation is completed to the center. It's preferable to take a small piece out so that you get enough room for mobilization of the rest of the nuclear fragments. Now turn the other half into alignment, and again that also is broken up into smaller pieces. It's not a very hard cataract, so it's easily breakable. Now once adequate number of pieces have been made, you can start eating up the nucleus pieces. You can see that the anterior chamber is so stable throughout the procedure. There is not even once a surge that is felt, and actually the pieces are coming towards the FICO tip, and the followability is so good. I'm using very minimal power because it's a soft cataract. Now when you reach towards the last pieces, it's very tricky because you know very well that there is no epinuclear plate supporting the posterior capsule. So you have to be very careful, reduce the parameters to the minimum and slowly complete the FICO. That's the end of the video. I hope you enjoyed the video. Thank you.